Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 96. Why does the government keep letting Medicare Advantage plan companies off the hook? Imagine that you had a bunch of companies that insured bank accounts while simultaneously planning and executing bank robberies. Further, imagine that individual depositors could sign up to have these companies insure these deposits instead of letting the government do it. Finally, imagine the government allowed these companies to get away with bank robberies instead of forcing them to stop their robberies and leave the bank robbery business. This is exactly the situation with Medicare Advantage plans, in my opinion. The federal government has known for years that Medicare Advantage plans have been overbilling the government through a process known as upcoding. Upcoding is when insurance companies charge for a medical condition that a patient may have but is not treated for. What has been the government response to this fraud? Basically, the government has allowed the fraud to continue since it refuses to stop it. This headline from the New York Times sums it up. Medicare Delays, a full crackdown on private health plans. That delay is bad enough, but the government continues to provide these bank robbers with money at taxpayer expense. The Centers for Medicare and Medicaid Services is planning to increase payments to Medicare Advantage plans by more than 3% from 2023 to 2024. Medicare Advantage companies don't need the money. They are doing quite well. One of the largest players in Medicare Advantage, United Health Group, beat Wall Street estimates for this year's first quarter and raised its annual forecast. Additionally, it makes no sense to increase payments to these companies when you consider that many health insurance CEOs make 7, 8, or 9-figure salaries. So what should the government do? It should freeze the payment rates to Medicare Advantage companies. They should crack down on overbilling and prosecute the CEOs and other top executives. Finally, the government should disband the companies that have been defrauding it. Personally, I want these bank robberies to end. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.